all this technology. Hi, everyone. It's U.S. Congressman Rick Larsen coming to you from the international headquarters of the 2nd Congressional District here in Everett, Washington. And I want to welcome folks for being on, and I want to welcome the two guests that we have here today from the Fred Hutchinson Research Center, and I'll introduce them in a moment. I want to thank you for joining me on this discussion today about the research and development of COVID-19 vaccines and therapeutics or treatments. And so one of the things I wanted to do today was help you all understand what a vaccine is and what it does, and what a therapeutic is and what it does as well. So we're gonna learn that. In a few moments, I'll introduce the panelists for the discussion today. But first, just an update on COVID-19 response and what it means for Washingtonians. So first off, I just want to say I do hear the frustration from people that I represent about the restrictions on movement, restrictions on business, and restrictions on visiting our friends and our family because of COVID-19. It is important that we just follow basic public health directives, as challenging as that is. And in Congress, we are trying to respond with another COVID-19 relief package that is broad-based, that will help small business, that will help families, that will help renters, that will assist people with financial help in many ways. And we're negotiating that even as we speak, and in Congress between the House and the Senate. And I'm ready at a moment's notice to fly back to Washington, D.C. to vote on that package once it gets done. So that work does continue. But a public health response to COVID-19 is a basic tenet of economic recovery. The public health response has to lead economic recovery, and we're going to hear a little bit about that. The recent news regarding the Food and Drug Administration, or the FDA's review of the Pfizer vaccine candidate, only reinforces the need for the U.S. Congress and the executive branch to work with our state and local governments to ensure that vaccines are distributed equitably and that vaccines are distributed efficiently. And that's an important part of getting the vaccines out. Nationwide distribution of new vaccines will require an unprecedented public health campaign and an unprecedented coordination between the federal government and state governments. And so just last week, I did urge House and Senate leaders to include funding in any upcoming pandemic relief package for states to hire even temporary workforce to transport and to store doses and conduct educational outreach on the vaccines. And we're going to hear a little bit about what these vaccines are and what they aren't, as well as what these treatments are and what they aren't as well. And I will note, cost cannot be a barrier to the vaccinations. I think you've all carried enough cost through this pandemic. We need to be sure that we are making the vaccines available at no cost to those who need it. Just a quick note about something, the shorthand is OWS, but that's Operation Warp Speed. You may have heard of that. As our panelists will tell you, researching and developing new vaccines and therapeutics is no simple task. You don't go to bed at night with no vaccine or treatment and wake up the next morning with a vaccine and with a treatment. It's much more complex than that. But in the past, vaccine development has taken anywhere from 10 to 15 years to ensure safety and effectiveness, even when combining private and public resources, which is what we've done with Operation Warp Speed. So in May, the federal government did establish this OWS with roughly $10 billion in supplemental funding that Congress approved, but it's your money, your U.S. taxpayer money. And so maybe no one has said thank you to any of you. I'm saying thank you to you, the U.S. taxpayer, for making that investment in vaccine development in this country, without which we could not have had as vaccines developed as quickly as possible. So really a true thank you to you all. The operation is a partnership among federal agencies and private firms to support the acceleration of research and development of vaccines, of treatments, and of diagnostics, those things that help us understand if you have COVID-19 or not. And in just under 7 months, several private firms have, with your money, have researched and developed vaccines which are currently under review and nearly ready for distribution, and we'll hear about that. So we're going to focus a lot on the research and development of vaccines and treatments, but a quick note about the distribution. Right now, you can go to the State Department of Health website. So you have tools to find this information. It's at doh.wa.gov. You can go to the state website to look at the state's interim vaccine distribution plan. If you want to know kind of what is going on, how we plan to distribute in our state, you can actually arm yourself with this information and not be left out in the cold on this. So doh.wa.gov. So Washington State is expected to receive about 62,000 initial doses of the Pfizer vaccine and a total of about 222,000 doses by the end of December, and that's according to the State Department of Health. Regular weekly shipments should begin January 2nd, in January, not January 2nd, in January. And planning has started to identify which groups should be first to be vaccinated, where vaccines can be efficiently distributed, and what hospitals or healthcare providers can best administer the vaccine. And the state has fully enrolled 189 organizations across the state as vaccine providers, and more applications are in review. So we are putting together the network in the state. There's a lot of challenges to this, to making this happen. The Pfizer vaccine and a follow-on Moderna vaccine both require very, very cold temperatures to store them. So that means manufacturing can be a challenge. Logistics, that is moving the vaccine from where it was manufactured to here, will be a challenge. Ensuring that the vaccines get distributed quickly once they're here, obviously is an important part, given the fact that you have to have this really cold storage. And then communicating accurate information to the public, which is in part what we're here to do today. You can go to the state's plan to look at the priority groups. Phase 1A includes healthcare workers, firefighters, first responders. Phase 1B includes older folks with underlying healthcare conditions and those in long-term care facilities. And then there's phases 2 and 3 as well. Again, you can take a look at all that. Snohomish County, where I'm sitting today, has its plan, an interim plan in place, and San Juan, Island, Whatcom, and Skagit are finalizing their plans. So, finally, I'll just say for folks, wear a mask, wash your hands, maintain at least 6 feet distance between yourself and others, as I am doing right now in my office, and stay home if you're sick. Those are really the basics. You can take care of yourself in that regard. So please do that. As we plan for the distribution and those plans continue to develop, I want to continue to share good scientific and accurate information and resources so you're well informed. And on that note, we've got a couple of people to help us do that. Dr. Jim Kublin is the principal staff scientist in the Vaccine and Infectious Disease Division at the Fred Hutchinson Research Center in Seattle. And Dr. Rachel Bender-Ignacio is an associate at the Vaccine and Infectious Disease Division at Fred Hutch. And they're going to talk a little bit about vaccines and treatments, and then we'll go into some Q&A. And so with that, sorry for the slightly long introduction, but I do want to first turn to Dr. Bender-Ignacio from the Hutch to talk a little bit about treatments and therapeutics, and this has to do with when people have COVID-19. This is before trying to stop them, which is, we'll talk about that for the vaccine. So, Dr. Ignacio, Bender-Ignacio, I turn over to you, and if you could just start by helping us understand, first off, what's a therapeutic? What does that word mean? Why do I need to be thinking about what that word is, and what does it mean for people like my mom, who's 83 and doesn't have COVID, but what if she were to get COVID, and what does that mean for her kind of treatment? So what are these therapeutics? What's going on? Please.
Absolutely. Thank you so much, Representative Larsen, for having us here today. A treatment is a medication, and that can take several forms. Many of the ones that you may have heard about that have been in the press recently are the monoclonal antibodies, which is essentially a laboratory-made antibody or part of the immune system that somebody can receive as an infusion, meaning a bag of IV fluid that drips into the body. And what it does is it helps create an immune response that goes and tackles the virus, prevents it from binding our cells and making us sick, or interrupting that process when we're already sick. So there are two of those that have emergency authorization from the FDA right now. The challenge is that what I just said is that they're available from an IV infusion, which means someone has to go into a clinic or a hospital, have an IV placed. It takes about an hour. They have some side effects potentially. They have to be carefully monitored. So these are potentially powerful treatments that we have for people at high risk of ending up in the hospital or worse. But we don't know if those will be able to get out to the whole population and treat everybody that we need, and they're cumbersome and difficult to manufacture. So that is not the end of looking for treatments for us. What we really need to do is look for a wide variety of treatments that can help people early in disease, meaning while they're still at home. The ideal treatment will be a pill that can be prescribed just like an antibiotic. In this case would be an antiviral or some other immune blocking agent that your primary care doctor could prescribe for you, and you could pick up at the pharmacy, or in the case of being in isolation, could be delivered at your door. We're not there yet, but treatments for the outpatient setting, meaning people who have COVID but not sick enough to be in the hospital, are really the key intervention point. Not only is our hospitals overfull and ICUs are overfull, but the real impact on people's lives, their ability to go to work, to recover quickly, to prevent a sick person from infecting other people in their household, that all depends on being able to have early and effective treatments. And not only early and effective treatments, but ones that we can deliver to you, and that every Washingtonian, every US citizen, every global citizen can get. So I think that it's really important to realize that when we have vaccines, and when the vaccines are here, and when we're able to get those, that we're not done. We still need a safety mechanism for people who get sick to help get us back to work, to maybe make quarantine or isolation shorter for people who are infected, and to prevent what we now know is long COVID or post-COVID. So people who have really long symptoms that can be very, very debilitating. And so to try to figure out how can we change that so that this is more like a flu, because right now this is not the flu. This is so much worse than the flu.
Help me understand something before I go to Dr. Kublin. So I have allergies, and I'll take a brand name. I won't say a brand name because I can't endorse products. So I'll take a brand name allergy medicine, and that's a pill, and it's an over the counter, and I already have the allergy. So in that sense, I already have the illness, and I take a pill to kind of suppress that, suppress the allergy. And what you're saying is that we're not at that point with COVID-19. There isn't a pill that you can take to suppress and to fight back the COVID-19 in your body. You have to go. That is, if prescribed, if the doctor or healthcare provider says so, it has to be an infusion. It's in the bloodstream. You've got to leave the home. It's an hour long. There's side effects. You have to be monitored before you can go. So we're just not at that point yet with treatments. Is that right?
Yeah, absolutely. And it's also really important to remember that all of our national governing bodies and scientists who weighed in really want to emphasize that the two treatments that have emergency approval don't have enough data yet to really become the standard of care.
Oh.
We think that they are safe and we think that they're effective, but part of the reason why we are continuing to run clinical studies like the one behind me, Rise Above COVID, which is part of Operation Warp Speed, and the ones that we're doing here at the Hutch, is because we need more data to know exactly how well they work, to know if they work in older folks, younger folks, folks with different medical problems and different backgrounds. And so we don't have a pill, but we also don't even know that the ones that have, emergency use authorization, if that is really, that's not the holy grail yet.
Yeah. Thanks. I'm going to move to Dr. Kublin, but before I do, I want to thank Dr. Ben Ignacio, who's going to be with us for Q&A. I just want to take a moment to thank the people who live in the 2nd Congressional District who supported the CARES Act. The CARES Act that we passed earlier this year, very important bill that helped with a lot of people with COVID-19 relief. For instance, 8,570 businesses in the district received paycheck protection program loans. And that saved about 60,000 jobs at the time. And so just a shout out to the people I have the privilege to represent for helping out. And I just want to say it's time for Congress to pass another COVID-19 relief package as well. And so again, just thanks. I want to thank my in-house producer, Lindsay, for handing me that as well. And now we'll move on to Dr. Jim Kublin, again, Principal Staff Scientist at Vaccine and Infectious Disease Division at the Hutch. Jim, what do you got for us?
Well, thanks, Representative Larsen, for again inviting us to join you and your constituents. And also thank them for, all of our contributions to Operation Warp Speed, OWS, as we call it. And another acronym coming up is the COVID-19 Prevention Network, which we call CoVPN. And the CoVPN was founded on the platform of HIV vaccine trials network activities. Dr. Fauci asked Fred Hutch to take on responsibilities to lead these operations around COVID-19 vaccine efficacy trials. And so that went back into March, April discussions. And since that time, we've been very involved in helping coordinate and actually contribute to the implementation and design of these phase 3 efficacy trials. And you mentioned the Pfizer results that were considered by the FDA yesterday. I consider that to be a major milestone for us in the scientific community, but also in the global community, in which all of us are likely to benefit from the progress that's been made so far. And so we're really excited about that. There were press releases over the past month from Pfizer and Moderna regarding their preliminary results. And as a scientist, we usually don't rely on press releases to interrogate and understand how well the scientific evidence is leading us. But now with the data that's been available this week from Pfizer, it's incredibly rewarding to see that data. Their vaccine is a messenger RNA based vaccine, or mRNA, which is a nucleic acid vaccine, very similar to the Moderna vaccine. So both of those products are very, very similar. And that's reflected as well by the press release reports of their vaccine efficacy of approximately 95%, which is fantastic in preventing moderate to severe disease. And so we're really excited about these results. We've contributed to both of those platforms, more so with the Moderna platform. And so we're very excited in the coming week. We'll have also the very concrete data that will be submitted to the FDA for their emergency use authorization, or EUA.
For the Moderna?
For the Moderna, yeah. That's going to be reviewed by the FDA on Thursday next week. So there will be data likely to be released on Tuesday. It's available to the public on the FDA website. There were over 15,000 people watching that FDA panel review yesterday. It's a live broadcast event. Anyone can join it.
I watched some of it.
Yeah, it was, some of it's a little slow, and Not all that interesting, but
Guaranteed.
yeah, it went on for 8-10 hours. But within all of that, and within the data that you can access and download, at the at the FDA website, you can see this tremendous evidence. There's the main figure plot shows the cases of incidence of COVID-19 in the placebo arm that just goes up and up and up throughout the course of the Pfizer study. And in the active vaccine arm, it goes up for about 14 days after the first injection, and then it plateaus and is flat for the remaining 112 days of follow-up of individuals in that study. And that is one of the great scientific figures that we'll remember from this pandemic as a scientist, because of how impactful and successful that vaccine and likely these other vaccines will be. So it's been a big week for us, and we're really excited about that. But many challenges, of course, are ahead. An efficacious or an effective vaccine doesn't control a pandemic. Vaccination, immunization does. And that means, getting the public willing to take these vaccines, not only for their personal protection and benefit, but how that also contributes to the community based prevention. As more people become vaccinated, we'll be able to control this epidemic more successfully. So these are some of the highlights most recently in this past week that we're really excited about. I can describe all the platforms and different vaccines that we have in the portfolio. In the next few days, we're hoping to launch the protein adjuvant vaccine that is in the development by Novavax, which we're very excited about as well. And we need to move forward through all of these efficacy trials and to make sure that they're all safe and they're all showing a good vaccine efficacy, and then continue to monitor what we call the effectiveness of these studies when they really are deployed into the communities to ensure that they're working as well as they did in these very well-controlled phase 3 efficacy trials. So many challenges ahead of us, but we're really energized by the data from this week.
So a couple of questions for you, Dr. Kublin. Actually, we got some viewers, and I have proof of that because I have notes from my in-house producer, Lindsay, who wrote these questions down on a actual piece of paper. So that is, by definition, means we have people watching. They actually are. So from Sue, Sue asked about the safety data. You mentioned the data, but has the safety data been released from clinical vaccine trials? And if so, what does the scientific community think of that?
So the safety data for Pfizer has been released and described in their document that they sent around. And that document's most recent time I looked is only 53 pages. So
is that the executive summary?
And that's pretty much of a summary. It doesn't have all of the hundreds of pages of tables and such, but there's also a very nice summary on a slide deck that was provided by one of the lead physicians at FDA, summarizing the safety of the product. And when you're into a population of tens of thousands of individuals, many of whom you're trying to enroll because they have pre-existing medical conditions, we're going to see events occur. We're going to see, even in some circumstances, people pass away and die because of their pre-existing conditions, and simply because motor vehicle accidents happen. There are life events that occur in these clinical trials that are unexpected. But the safety monitoring is very rigorous with regard to vaccine-associated events. And indeed, there were more in the vaccine arm, quite literally and figuratively, than the placebo arm. So a little bit more local reactogenicity, a little more redness and swelling and pain in the vaccine arm versus
I'm sorry, could you explain what reactogenicity is? That's a
Of
really
course,
long
I'm sorry.
word.
That's the local reaction that the vaccine has caused in the focused area where the injection was given.
Okay, so got it. So it might be a slight swelling, it might be a red rash, it might be.
That's right. Just a little redness, a little more swelling than anticipated. And so that was observed to be increased in the vaccine arm versus the placebo arm, where they just injected a salt solution. And there were a few more systemic type of reactions as well. Mild flu-like reaction, mild aches and pains. And these are the consequence of the vaccine inducing the immune system. That the immune system is what typically causes these kinds of reactions to an infection, like flu itself. It's not the virus particle itself, but it's this immune reaction to the infection that causes most of these symptoms.
It's the no pain, no gain aspect of the vaccine.
I guess we're going to have to start using that. Yeah, exactly.
Seeing trademark. I'm sorry, you have to pay me for that.
All right, we'll negotiate a contract with the office.
Yeah.
No pain, no gain, and fortunately, the pain is not that severe.
Yeah.
And it was observed to be a little bit increased after the second dose for these mRNA vaccines, both Pfizer and Moderna. And we knew that from the early phase studies in which a few hundred people were given the vaccine or placebo. And so we were expecting these safety signals to manifest themselves when we went into tens of thousands. And that's indeed what we saw.
Can I stop you there? Because I want, for Dr. Bender, Ignacio, is the safety data available for some of these treatments, some of these therapeutics as well? Are they publicly available? Can people go take a look? If someone's concerned about mom or dad taking these infusions, where would they go to have their concerns allayed or confirmed?
Yeah, absolutely. So similar to the vaccines, for anything that has approval or emergency use authorization from the FDA, that data is visible there. And when the FDA releases a statement, they have actually I think it's quite readable, sort of a short summary statement that talks about why these are getting an emergency approval or emergency authorization, the treatment effects or the benefits of it, as well as some of the main side effects and the unknowns. So they're very transparent about why these treatments don't yet have a full approval, and that's really just because we need more people, more time, and more clinical studies. Yeah.
Hey, on that point, I know I talked to you two a few weeks back, and I think maybe Dr. Kublin made the pitch for people. Maybe that was you, Dr. Bender Ignacio, about the need for people in these trials. We need people in the trials, but look, if someone wants to participate, if someone wants to contribute themselves, is there room for them to contribute either in the trials coming up for new vaccines or trials for existing treatments and treatments that they're looking into?
Absolutely. It's very easy to find. We've actually been working with internet search providers to be able to make it that if you Google participate in a vaccine study or participate in a COVID treatment study, they're easy to find. Again, the Operation Warp Speed outpatient study is looking for folks that have tested positive with a nasal swab positive within the last week. And that's riseabovecovid.org. So that's right there behind me. The Fred Hutch website has an easy click button. And for the folks up in the 2nd District, depending on where in the 2nd you live, you're close enough to Seattle to be able to participate in some of these studies. We also have, we're working on, we don't yet have off the ground remote studies that will all happen via getting supplies to your house, and phone conversations or internet interactions to help us. And these would be for if it was an oral treatment, so a pill. And then the vaccine studies, Prevent COVID, a website as well, easy to participate in. And I know, Jim, that there's sites up in Snohomish as well, right?
That's right. We have a national network at the preventcovid.org. Over now 500,000 people across the country who have registered in that portal, in that registry, and it's been very effective, for participating in these clinical trials. And what we do is ask a few questions with regard to occupation, social activities, and then of course contact information and a little bit on pre-existing conditions. And it's on a very secure platform. There's been a lot of cybersecurity issues during this pandemic. This platform has been secure throughout that period of time, and we're going to continue to maintain it that way, of course. And so at preventcovid.org, for the preventive vaccines, that's really been the most constructive platform for people to participate in these vaccine clinical trials. And I'd say that, these placebo-controlled trials, even though we're going to have tens of thousands of doses, rolling out in the coming months, that's not going to be available to everyone. And and so participation in these clinical trials will be that much more important. We've actually redesigned the studies. So instead of a 1-to-1 randomization, it's now 2-to-1. So you have a 2-to-1 chance of getting the vaccine versus placebo. And at the end of these studies, if the vaccine is proven to be effective, as in the Moderna and Pfizer studies, the placebo recipients will have access to the active vaccine. So we're hoping to continue these randomized clinical trials through the winter and even into the spring to confirm the safety and immunogenicity and efficacy of these other platforms.
So there is opportunity if folks were like, what else can I do? I feel helpless with this pandemic. There is actually opportunity for them to participate and be part of the solution on this too, and presumably break to their friends.
Yeah,
that's right. Yep.
One of the key things that we can say about participating in the treatment studies is that, whether or not you receive the active study product or placebo, whether it works or not, I think most people that we've interacted with really find participating in these studies to be beneficial to them. When you're at home during isolation, during quarantine, sick, scared, having somebody who will call you every day or text you, see you in person, sometimes even come out to your house, has just been really a wonderful experience, I think, for a lot of folks to just know that they're getting personalized attention and somebody watching them, and to make sure that they're not getting sick or answering questions. We've talked to a lot of folks about how to maneuver with family members and coworkers and how to keep everybody safe in their households once they find out that they've been diagnosed with COVID. So really, whether or not a treatment in a study ends up helping you personally, you're really helping your fellow Washingtonians, your fellow Americans, and just give that plug for just the wonderful experience that we've had creating relationships with people who are not feeling their best at that moment.
Yeah. And Dr. Kublin, just to clarify, the 500,000, 500,000 people in the network, that's people signing up and then they might be selected. Is that right? You're creating a database of people that you're sifting through to say who would be good candidates and who wouldn't be. Is that right?
That's correct. Not everyone in that registry is ending up in a clinical trial itself. And we've been sending out communications and updates to all of the participants. We've also had a fantastic collection of videos and testimonials echoing what Rachel mentioned regarding, the gratification and satisfaction it is to participate and why people are participating. And so we have a nice public service announcement compiled of some of these testimonials from participants in the registry, narrated by Harrison Ford, and which in and of itself is a very satisfying 90-second clip to watch. So people, I think it is one way to really step up and participate and try to contribute, as we all are trying to do at this time.
Yeah, great. I'm going to pause for a moment for another, speaking of PSAs and public service announcements, I just want to take a moment to remind everybody on the Facebook Live event that this Tuesday, December 15th, is the last day of the open enrollment period in Washington State to sign up for health and dental coverage. That will begin on January 1st, 2021. So if you want healthcare coverage, you're looking for healthcare coverage by January 1st, you need to sign up. You can sign up through Washington State at wahealthplanfinder.org. And I've got a chart back here. Oh yeah, so here, can you guys read that? Can you read that? Is that good enough for you? So yeah, this one here, Washington Health Plan Finder, wahealthplanfinder.org is where you can sign up for healthcare coverage. So I just, since we're doing this event today, I wanted to take an opportunity to put a plug in for people to sign up for healthcare coverage. Also note, Fred Hutch is there on fredhutch.org. And not just a great research center, but one of the greatest baseball players to ever come out of Washington State in the Major League. So, and then, of course, I mentioned this one earlier, doh.wa.gov is the Washington Department of Health. And mine is larsen.house.gov for Rep. Rick Larsen. So those will be, generally available for folks, but keep in mind, but this one's important right now just because of sign up for healthcare coverage at wahealthplanfinder.org. So if you're looking for healthcare, that's where you need to go. Take care of that. So back to some questions. And again, Robert got in and said he's been wondering how. Oh, this is great. If you get the vaccine, how should you behave? Should you still wear a mask? Should you still be social distance? Can you live your life without? What does the vaccine mean for someone?
And that's a great question, and one that honestly we don't have an answer to yet.
Okay. Well, next question. No, go ahead.
Yeah. And the reason is because the efficacy trials have confirmed that the vaccines are very effective in preventing disease. And so we will be looking at this very carefully in the next few months, and be able to assess whether or not it's actually preventing infection as well. And by preventing infection, thereby preventing infectiousness. Whereas typically with many respiratory infections, such as the flu vaccine, it does reduce severity of disease, but not necessarily acquisition of the virus. So many people are still infected, and in some circumstances may still be able to transmit the disease. So until we know that the answer to this question, we're not going to be able to recommend that people not wear a mask. So wearing masks will likely continue to be a critical public health measure over the coming months. But hopefully by February, we'll know the answer to that question. And we're looking at also a vaccine study among college students through the winter that will additionally confirm this finding. Yeah.
Okay. Maybe you should start with the University of Washington Husky football team.
Exactly.
Who, for those of people who know, the game against the University of Oregon was canceled tomorrow because of COVID-19 issues running through the Husky program. But Dr. Bender Ignacio, you just put in the chat, and I think it's a good reminder about health insurance coverage and participating either in treatment trials or in vaccine trials. Do you need health insurance to be able to do this?
No, you do not need health insurance for either vaccine or treatment studies. It's not even necessary to have a social security number. So we are welcoming everybody to participate. None of these studies are at any cost to you. In fact, all of these studies will reimburse you for your time, meaning pay you money. Depending on the study, it's more or less money, depending on how many visits and how intense the follow-up is. But it's never at any cost to you, and we will not bill your insurance if you have it.
You will pay people to help others get their lives back?
We will pay people help other people get their life back. Exactly.
Sounds like a really good deal to me. So back to this other question about whether or not to get the vaccine. The two that have been, well, Pfizer's got the emergency use. Presumably Moderna gets it next week. Those are 2-dose vaccines. Just this morning, I heard news that one of the other 4, they either delayed or it won't be till the end of the year because the data coming back for people who are 65 and over is not coming back very good. So if you could address that as well, then as address this idea of a 2-vaccine dose, 2-dose vaccine versus potentially 1-dose vaccines in the future.
Sure. So we mentioned the Pfizer, Moderna mRNA vaccines. The next 2 are viral vector vaccines, and this means that a virus is constructed with a little piece of the coronavirus inside of it, and it actually happens to be the identical piece that was inserted into the mRNA vaccine. So it's the spike protein of the virus. And so
you say on the spike protein. So we see the pictures of the COVID-19 virus, right? It's blown up 1 billion times. It's essentially a ball, and it's got these little trees on them. And is that the spike protein?
That's right. It's what we call an envelope protein that sticks out through the surface of the virus, and that the immune system responds to very effectively.
Okay.
And so when we are giving these viral vector vaccines, they are delivering a piece of this spike protein. And of the 2, Janssen and AstraZeneca, the Janssen candidate is a single-dose vaccine regimen. So we're very hopeful that the immune responses elicited by that vaccine will be very effective. And we also then, the other 2 candidates behind them are the more standard traditional type of vaccine, which is a protein adjuvant vaccine. It is the spike protein, configured in the same way that these other candidates are using. And that's combined with an adjuvant to help boost the immune response.
How's that word spelled?
ADJUVANT, adjuvant.
Adjuvant, okay.
And that's a boosting of the vaccine response, adjuvanting the vaccine response. And these protein adjuvant vaccines will be rolling out very soon. The first one, as I mentioned, Novavax, hopefully in the next few days. And then the other one is manufactured by Sanofi, which will follow.
So I'm sorry, have those been approved then?
They've been approved for these clinical tests.
Okay, so we say roll out, they're being rolled out for the trials.
Sorry, yeah, they're just being rolled out for the efficacy testing.
And
they will be rolled out for use later in 2021.
Yeah, just any approximate dates on those, given the length of the trials and so on, and assuming all the milestones are hit? No, I won't hold you to it. They're just saying what the timeline.
One thing that's very favorable about these protein adjuvant vaccines is the scale of manufacturing into the billions of doses. But one of those challenges is the manufacturing, which is typically a bit delayed compared to these other strategies. So that's why they're only starting the phase 3 trials now, whereas the others started in July and August. So that means they're delayed by 3 or 4 months from these other vaccine platforms that started earlier. And But again, are the platforms that are more tested, more proven in children and in pregnant women. So we still urgently need to evaluate these and also have the more global scale manufacturing capacity.
Yeah, so the protein adjuvant has been, that type of vaccine base has been more effective with pregnant women and for children.
Yeah, more
So
proven.
Give me an example of an existing vaccine that's a protein adjuvant base that we use every day.
Diphtheria, tetanus, the typical vaccines one thinks about for use.
So some of the science isn't new, particularly that this is a new, COVID-19 is a new virus. And we've got to apply what we know to addressing the problems that COVID-19 specifically brings.
Yep.
Yeah. Maybe for both of you, there's an additional question from Sue. And she said, if you've had the COVID-19 infection already, do you still need to get the vaccine? If you have antibodies for COVID-19, do you still need to get the vaccine? And there's probably some relationship to treatment here in therapeutics, but if you've had it, I mean, are you immune or?
That's a great question, Sue. And there appears to be evidence that if you have had it and you have antibodies against the virus as a result of that initial infection, you are protected. But what we don't know is how long you're protected. And there's some evidence suggesting that people are getting reinfected now that we've been in this pandemic for almost a year. And so the next few months will really shed light on the rates of reinfection among those who have been previously infected. So typically antibody responses may last for decades, depending on what type of infection you have. Sometimes those antibodies drop considerably in 6 to 12 months after the initial infection. And because we haven't even been in this pandemic for a year, we're still evaluating that. So there may be the need for booster vaccines. We don't quite know that yet. And indeed, there may be a critical need for people who have previously been infected to get a vaccine to further protect them in the future. Many participants in the clinical trials by Pfizer and Moderna were previously infected. And so there is some indication that they are sufficiently safe in individuals who have pre-existing antibodies. But that analysis is also pending. And we need further evidence that that's the case.
How about on Dr. Ignacio, how about on folks who have had COVID-19 and then maybe got a treatment too? Do we know if they're more protected from COVID-19 than otherwise?
Well, it entirely depends on what the type of treatment was. So for these monoclonal antibody infusions and hopefully injections someday, so hopefully someday they won't just be an IV bag. They might actually be able to be a jab in the arm. But
I hope it's a little less violent than that, but how?
Oh, I think, yeah, I picked up on the flu jab because now that the UK is beginning to vaccinate for COVID, everybody's talking about getting their COVID jab because that's Queen's English.
Is that right?
Yeah, they get their COVID jab.
We rejected that about 230 years ago, so we'll come up with that.
In any case, so for that type of treatment, the monoclonal antibodies, that's providing an immune response that's maybe not as complete as an immune response from vaccination. But we think that those antibodies, based on the way they've been engineered in a lab, are actually designed to stick around for a long time and maybe in the body for 3 or 6 months. And that's on top of the antibodies that people are already making from being infected. So in these treatment studies, everybody has had a verified COVID positive test before we enroll them. And so we think people have their own immunity plus this extra boost of protective antibodies. At this point, we've been having these exact conversations in Operation Warp Speed about should we suggest people get vaccinated, not suggest. At this point in time, our suggestion is that people follow the CDC and the national guidance on vaccination. which I believe is suggesting that people can wait 3 months after they've had a verified infection, not because we don't think they shouldn't get vaccinated, but maybe just while there are queues for vaccines, that it will let other people get to the front of the line while they're still in that period where we feel pretty confident that they're protected against reinfection. But overall, we do think that people who've been infected should ultimately get vaccinated, but maybe let folks who are more vulnerable kind of pass them up on the first round of vaccines.
Just a quick note before we wrap up. I do want to recognize that Mayor Tim Collison from Langley is viewing. I appreciate Mayor Collison listening in as well, and hope we can spread the word about this, Tim. And one final promotional bit here. I want to be sure people understand. Probably the most important news coming up is that the Seattle Sounders play the Columbus Crew tomorrow at 5 p.m. Pacific time in the MLS Cup. And do not bother me at that time. Do not bother me between 5 and 8 o'clock. I will be busy watching the Sounders. Playing for their third title in 5 years, maybe, something like that. It's pretty incredible. So looking forward to that. I love what the Sounders coach, Brian Schmetzer, said about if they win, well, he was asked, if they win, will you be a dynasty? And he said, no, we're still gonna be storm chasers, meaning he was referring to the Seattle Storm dynasty, recognizing the Storm's great dynastic legacy in the WNBA, which is a class act, Brian Schmetzer. So that's my final promo today. One quick, if you can answer this question quickly from Bella, and then I've got a question for each of you before we wrap up. People who are immunocompromised, do we anticipate problems with vaccines, and have we seen anything on the therapeutic side if they've got something more serious with their immune system going into these?
Yeah, that's a great question, and we don't really know the the outcome of vaccination in those severely immunocompromised. We will have data on people who are HIV infected in these efficacy trials. People who were living with HIV, who are HIV infected, were participating in the phase 3 efficacy trials. So we advocated for that and made a clear case that they be included in these trials, and we'll be able to look at whether or not their immune responses elicited by the vaccine are the same as others. We expect that they likely are, but of course there are many other immunocompromised conditions out there, and so we're going to have to treat this very carefully moving forward.
And I presume in the trials there's an effort to be sure there's a broad range of demographics represented as well, people of color, as for instance ages, and so on.
Yeah, we played a critical role in actually contributing to ensuring those demographics were enrolled in the Moderna trial. And our sites, we have over 220 sites around the world contributing to these COVID vaccine clinical trials. And in Moderna, we had over 30, and they had a significant contribution to make enrolling these demographics.
Right. And Dr. Ignacio, I have the same question about immunocompromised folks in the therapeutic.
We think that the medications that work as antivirals and the monoclonal antibodies are very safe for people that are immunocompromised, and actually are important treatments for them because they can kind of help take over for people whose immune system isn't working well enough to route the infection on their own. Some of the treatments that I didn't focus on as much for people who are in the hospital are aimed at people who are having sort of too much immune response that's causing lung damage. And some of those, depending on which type, are not recommended for people who have a really suppressed immune system. But for all of these outpatient studies, we're really welcoming people who have a variety of medical problems, including problems with their immune system, and people who are living with HIV, because we think that they're safe and important treatments to study in those populations.
Great. And final wrap-up question for each of you. It's more of a personal question. Dr. Kublin, Why did you even start doing this? When you were, what did the 10-year-old Dr. Kublin think he was going to be doing at this age? And is this part of a master plan, or did you stumble into this because you flunked out of poli-sci classes? Chemistry was easier.
Yeah, I found biology much more interesting than accounting and economics. So I guess I'm living up to the reputation of physicians not being necessarily the greatest investors. So, it really was a result of a year that I spent in Nicaragua in 1981 as a young dropout from college, and working as a village healthcare worker and becoming completely entranced and fascinated by the malaria life cycle and the biology of that and the challenges of developing a malaria vaccine, which we're still working on.
Yeah. So, lesson from you: drop out of college led to saving people's lives. Great message.
There you go.
And how about Dr. Ben Ignacio, from your end of things? How did you end up on this call today?
Well, I think I've wanted to be a physician since after I gave up wanting to be a paleontologist when I was in elementary school, when I realized I couldn't hunt dinosaurs for a living. But I really, throughout college, got a taste of global health and working with underserved populations. And I was a religion major, and I ended up as an HIV researcher. Both Jim and I were HIV researchers prior to the pandemic, because I realized that it's an infection that's not just about biology. It's really about how people view life and death and birth and sex and politics and all of these things that make infections so messy. It's not just about treatments and vaccines. And so that really motivated me to go into HIV research, to really understand how to sort of solve problems holistically with communities on a society level, as well as the biology. And we're seeing that play out for COVID. And so I think it's really a natural fit, is that, if this were just a biologic disease and everybody understood the science, was willing to be on board with the science, and there weren't other factors in play, it would be easy. But there's not. It's people's lives, there's economics, there's politics, there's health systems, there's getting the treatments to people. It's a much more complex process, and the interpersonal relationships that are hard to manage right now during a pandemic, when we can't, go over to our parents' house for Thanksgiving. So it's kind of a direct correlation there.
Yeah. Well, thanks for dumping dinosaurs and moving over to from really, really gigantic things to really, really small things, and helping us address this pandemic. To both of you, really appreciate it. Thanks for being scientists. Thanks for talking, for learning the science, so that non-scientists like me and many others can turn to you and rely on you to do the right thing and help us get through this pandemic. Appreciate your conversation today and helping us all understand where we are in the world of vaccines and therapeutics, as well as where we need to still go. And I would say that the vaccines provide us a light at the end of the tunnel. The tunnel's still pretty long, but there is a little bit of light there at the end of the tunnel, and we just got to keep hanging out and wear those masks, wash your hands, practice social distancing, stay home if you're sick, folks. And with that, I'll just say go Sounders and go Hawks. So, all right. Thank you so much. You guys are great. Appreciate it.
Hi, thank you.
Thank you, everybody. Thanks for listening, watching. We'll talk to you later. Bye.